All right, I would like to once again welcome an amazing resourceful fellow who is in charge of SCORE for Southern Arizona. Last week was exceptional. As a teaching tool, it was excellent. And we're very grateful you were able to come back today. So the show is yours.
Well, thank you very much. It's a pleasure to be back with you. I was very impressed by the material that I received. You had a combination of business plan, marketing plan, but I saw a lot of very, very good research done. You seem to know your markets really well. And so you guys are on your way, is what I can say. So I'm going to start sharing my screen here. And I do have everything, amazingly enough. So come on, there we are. And then I'm going to go to the slideshow. Okay, there we are. This slide you've seen before. So what I want to start with is to give you some feedback on the marketing plans. And then since we're talking about marketing, I'm going to give you a preview of something that you can actually access, which is simple steps for starting your business, which includes marketing, it includes financials, but we're just going to focus today on marketing and the startup process. And we'll have discussions around that. So let me get started. All of the information that I got, you all pretty well nailed it about who the target client is. And I really liked Paige's explanation or synopsis, which are individuals with complex chronic conditions and those who have any recent life-changing diagnoses, and they need help navigating the convoluted healthcare system. I think everybody concurs that that's where you want to be. And some of you took a little bit of a deeper dive and looked at age, and some of you were very clear about where the patients were going to be coming from. So I just want to point out some things that are kind of next for you. So just some things for you to consider. I'm not saying that anything you did was wrong, because it wasn't. So I would encourage you to differentiate between the end user, who's the patient. That person may or may not retain you or retain your services, or the decision maker, which could be a parent or a guardian or someone who is actually taking care of the person. So you have to kind of market to both. You have to gain the trust of the patient, of course, because that's the person you're going to help them navigate through the system and navigate through their condition. But the decision maker sometimes also writes the check. So they need to be kind of aware of what it is that you do and what you're doing, so that they hold you accountable for what you are promising. Some other things that I didn't see mentioned, but I think that I heard a little bit of it just as we came on, are referral networks. I mean, this is a great place for you to find new clients. Your professional peers. I mean, you work with a lot of healthcare professionals, and once people know that you are out and doing your own thing, those are the people that should know about the new service that you're providing and the new life that you're embarking on. I didn't see anything. You counted a number of healthcare systems, number of hospitals. Physician practices could also be potential sources of referrals. Obviously, healthcare systems. I don't know, because I'm not the professional here, how healthcare systems would look upon healthcare or patient advocates if they would do a formal relationship with you, or how they would work with you. But so Karen has a perspective on that.
Okay. In the residential, these guys are going to learn these things. We have figured out the best way to get into hospital systems and effectively, and how to work with people on the floor, how to work with physicians. All of that is going to be covered, as well as you mentioned, in the beginning about the patient needs to know what we do, but also the one who's writing the check. Part of the screening process, when you screen somebody and one of them is elderly and perhaps not able to follow, you always have somebody else on the phone. You always have the caregiver or the husband, the wife, whatever. I'm done.
Excellent. Okay.
But
So,
we can ask you questions as we move forward, yes?
Absolutely. Absolutely, you can. So another source of referrals are disease support groups. There are people who are either caretakers or they are suffering from the disease themselves, and they go to support groups. And they're always looking for solutions. They're always looking for support. A patient advocate could play a really critical role there, because you are the subject matter expert in either the disease management or certainly navigating through the healthcare network. So that puts you in a really good position to be kind of a go-to source. Another avenue for getting people through your door is being part of a disease association. And I don't know what else to call it, like the American Cancer Society, the American Diabetes Association, the Heart Association. Those organizations provide resources either to patients or caregivers. And so you could be part of the referrals that they provide to their members. Another one, this is one that I'm familiar with because I worked with elder care a long time ago, is elder care attorneys, but they have to be dedicated to that practice. Did I touch a nerve here or what?
Oh, and listen, part of the marketing for elder care attorneys is we can keep their people alive longer with better health. And also one of our tools, the Medikey, they just snapped right on it like a big fish. They love what we do, and they're an excellent referral network. Excellent.
Okay, so I don't seem to be telling you anything you don't know, but I'm just suggesting that these are places where you can create a presence and people will come to you, and you can substantially increase your client base. So the other part that I didn't see, and I know it's still early in the game for you all, but it's, naming the benefits and the features of your service. I saw the contract, it's lengthy, and it really does talk about a lot of things, but I think you need the 30-second elevator speech that really talks about the benefits and the features of what it is that you do in a very understandable, graspable way, and also who you are and why they should choose you. One, your license as a registered nurse. Now you have patient advocate certification. You have X number of years of experience, and you can even name the type of practice that you've been in or the type of healthcare system that you've been in. So you have a lot of credibility as a subject matter expert, not only with your credentials, but also with your expertise. And so when you say that you do this service, those credentials, play a good part in giving you additional credibility. And then after you figure out what your message is, then, what are the media vehicles that you're going to use? And I think we talked a little bit about this. If you don't have a website, you don't have a business, period, end of story. So, one of the first things that you need to set up, really, it's almost like as important as your phone these days, is to have a website with your messaging, with your credentials, with what it is that you do, who you serve, all of those things, and how people get a hold of you. The other thing I would encourage you to have on your website is kind of a blog. You are the thought leader in patient advocacy. So if you write an article or two, if you can, or get someone to ghostwrite it for you, it talks about what patient advocacy is, how you do it, what you do, how it benefits the patients, And over time, you can put, video testimonials on there. And that's what's going to attract people. So when they go searching for patient advocates, you want to be right there at the top, just below the people who pay. And so that people actually go to your website and reach out to you. Social media is important similarly to actually expand your reach. And the question for you, and I don't really know this, is of your patients, of your customers, what type of media do they use? I think that's a question you might want to ask them as you engage with a client, so that you know whether to put it on Facebook or whether to put it on Twitter or TikTok or whatever one it is, whichever one has the most reach. You can't, yes, you can use all of them, but that's, for a small business is a little much. So try to find the most effective one. Yes, ma'am.
I think I may have mentioned this before, but in the National Nurses of Business Association, which is one you should join, they have, some of their members are nurses who are social media experts. And, I would consult with them for an hour or two. And, you may want to have them manage your social. I don't think you need to do that, but they'll teach you a lot about managing social media in our particular line of work.
And so most businesses these days, post-pandemic, not only have a personal relationship with their customers, they have a digital relationship with their customers, because that is how people now communicate, whether it's through text, it's email, Zoom, whatever it is, or websites. That's the norm, in addition to the in-person face-to-face, which is only now starting to come back. But you probably have more of the in-person face-to-face, but having a digital presence and a digital relationship with your customers is critical. Another suggestion is to hold informational seminars. I've seen a lot of professional people do that. And so they have 25, 30 people in an evening. You talk about what patient advocacy is, what the benefits are, all of that, how you help patients. And, you'll get a collection of probably 5 people that will do a follow-up appointment with you. And that's a good way of just keeping your client base evergreen. And some people will wait maybe a couple of years and they'll remember that informational seminar and they'll come back to you. So those are just ways of attracting, people to your business. Yes, ma'am.
I was thinking that.
Go ahead, Nan.
I'm sorry. I was thinking that if you're going to do informational seminars, then you need to get all this set up prior to that you would want to have a social media and a website, so that when you're talking to people that you're able to have them go back to that.
Yes, correct. Yes.
Well, also, we have crafted, and a couple of students have already purchased it. We have a number of different PowerPoints already set for these informational seminars. And I will tell you, this is the best way to get clients. If you can do it in person after Delta, then, you bring your information with you that they can pick up, and you have them give their name and email. You bring them cards, you bring them, all kinds of stuff. But if you're doing it on a Zoom, you can't do all of that handing out. So you may want to add a slide or two to the PowerPoint with all that information.
Yep. And if you are in person, it helps to have a takeaway, like a 3-fold brochure or something like that, that talks about your business and has all of the relevant information. So, yep. Okay. So what I'd like to do is introduce you to the SCORE tools that I use. And so this really is the webinar about marketing, about developing a marketing plan. And I'll play the video and hopefully it will work. I tested it before, so it should. And but it gives a lot of very good, useful information in a very concise way. And it'll give you some examples. And again, you will be absolutely free to access this because this is part of a 5-part module that talks about starting your business and marketing your business and doing all of these things. So the things that you are undergoing now. So let me stop sharing this and I'll share my other piece so we can get started. In the meantime, any questions?
Excuse me.
Yes, ma'am. Of course you can.
I don't know how long this video is, but they have already spent hours and hours beginning their marketing plan because we have a whole program, step 1, step 2, step 3. But what they don't have is business plan. Yeah.
Okay, we can be, okay, so, well, let me do this then. So if you have any questions about marketing, then this is the place to answer it, and then we can move to the business startup.
Thank you.
Easy. So, I don't know, because it seems to me anyway, that it's a fairly, patient advocacy is a fairly new field formally. So you might want to think about who your competitors are. And the reason you want to think about your competitors is because you want to survey them to find out what they're doing versus what you're doing and how much they're charging versus how much you're charging. And the consultants that I know that do use this fairly frequently, what they do is they survey their competitors, their fellow consultants. They find out what services they're offering, what their reputation looks like, what their pricing is, and then they set their pricing and they figure out where they need to be in terms of the type of service that they want to deliver. And so your competitors in that respect help you to understand where you fit or where you want to go and where the space is. Yes, Karen.
I'm sorry to keep interrupting, truly, but you said that was okay. There is a service started by a fellow who was misdiagnosed and lost most of all 4 limbs, who started something called Greater National Advocates. And in there, and the whole idea is to turn everybody in America onto what patient advocates are doing. And so if you go on there and you can join free of charge, that is a marketing tool in itself, but you can go on GNA and find out all of these other patient advocates who are not nurses, and even those who are nurses, what are they doing if they're not an RNPA? So there's it's real easy to find that kind of information out on GNA.
Terrific. Which leads directly to the next point. What differentiates you from other patient advocates? Well, you've taken a course, you've gotten certification, you are licensed nurses, registered nurses. I mean, those things are huge because that really puts you at a higher level compared to your competitors. And so that means a couple of things. You can charge more and you have better credentials. Yes, Karen.
Also, we are the only patient advocates who are schooled and trained in advanced science. We certainly know traditional Western medicine and when that is called for, but oftentimes, especially for chronic disease management, you need to go into advanced science. And currently, we're the only ones who are doing that.
And that's part of your features and benefits of your offerings. That should be part of your messaging.
Yeah, that's a big deal.
But that's a big deal, I think, within your circles, that you have to make it understandable to the patients who are lay people. Why is that important?
He's asking a question. Somebody answer, please, not me. You want to ask that question again?
Sure. Do you know, can you tell me, I'm a layperson, what are the features and the benefits of the service that you're providing? And I'm a diabetic, okay? So tell me how you're going to help me.
Oh, come on.
Okay,
Okay.
you're not going to make any money that way.
I'm sorry. That's
Okay,
I know that.
so,
Go ahead.
oh,
somebody.
sorry, go ahead, Paige.
No, go ahead, Deb. You go. You're cool.
So first
There's
of
no
all,
right or wrong
we're going-
answers here.
Yeah, so first of all, we're going to do a history and find out all your medications and any other problems you have and make we'll do the Medikey and get your whole history summarized, and you will be able to, this is portable, you'll be able to take this from doctor to doctor because we're going to collate all your history from all your different specialists. Then
Wow.
we're going to research the different treatments or options you have, be it alternative medicine or allopathic medicine. We're going to lay that all out for you and tell you the pros and cons to each, and then let you pick what route you want to take. Then whatever route you want to take, we are going to help facilitate you finding the right practitioners to help you go that route and interface with them if you need us to.
Wow.
Oh, we
And-
got to tell you about the Medicaid, not right now, but this is at NIH right now being considered for national funding.
Terrific. So does that mean you go to the doctor's appointment with me?
We can, if you need us to go to the doctor's appointment, we can. We can be at the bedside in hospitals with you. We can go through and check all your medications and see if there's anything that's counteracting together. We also can go through and do like a supplement optimization plan, because all medications are making you deficient in something. So, I mean,
Okay.
we do as little or as much as you need.
Okay. Well, so I'm a male. Okay. And so the complaint I've always heard from female spouses is that we never ask the right questions, or we never ask enough questions. So that's why I would want a patient advocate to at least ask the questions that I don't even know to ask.
Right. Yep.
Okay. So,
Well, preparatory to going to a doctor's office with our clients, we create 2 question lists. One of which is for the patient to ask, and we make certain that they understand what and why they're asking. This is not Pinocchio time. This is engagement between them and the provider. And then the other one on real technical questions, that's for us to ask. So we go well prepared. Yeah.
excellent. So, I mean, that's a very comprehensive perspective. That's a huge package that you're offering. I mean, to understand, I mean, I don't understand my medical history. I mean, I've traveled through a lot of different places, a lot of different doctors. I have tons of, blood panel information, but I don't have it all in one place. And I certainly don't know how all of the medications that I'm taking are affecting me now, and whether I should be continuing to take them. So
You should have an RN patient advocate at least for a few hours.
okay, somebody's going to be hired from this class. So, but those are really wonderful message points that I think you need to showcase, so that the person that you're talking to, your prospective client and the patient, really understands that you go far and above beyond just going to the doctor and putting them, in the hospital or in the healthcare system, because you actually are helping them plan how they're going to manage their illness going forward. And you're actually getting the right providers that they couldn't do by themselves because they don't know the system.
Right.
That, by the way, Deb, that was great. Thank you. That was a really
Yep.
nice description.
Yep. So you guys have nailed all this. So the real question for your marketing plan is, how are you going to reach out and attract clients? And that goes back a little bit to, what I talked about in the previous slide, which is, how you're going to reach out to, how are you going to use these resources that you already have to get patients through your door? So that's really that's the core of your marketing plan. And I don't want to neglect it necessarily, but selling is not marketing.
Thank
And-
you.
and So marketing, what marketing does is it opens the door for people to gain awareness of what you do and who you are. But at the end of the day, when they walk in your door, you have to close the deal. You have to say, here, sign here. I need a check for $1,500. And then we can go. And I would say to you, most people are timid about that or a little ashamed about that. But you bring so much value. So you should be absolutely shameless about asking for this money.
Now, that's something that, thank you, and repeat that, because nurses are not used to charging. In the clinical setting, we're not even charging there. They pay us the same way they pay the linen. We're right in there with the pillowcases. So we're not used to establishing our value.
But you have tremendous value because you can help a person recover their health. I mean, they can substantially increase their chances of becoming healthy again with your help. Without it, it's a roll of the dice.
It really is. It really is, because hospital error is the #3 cause of death in the country. And if you look at, there's also been people that have tabulated it out that go on to say that medical intervention is the #1 cause of death in the country.
That's scary, right? Misdiagnosis, medical error, medication error. Oh, Lord, yeah.
I mean, in that #3 cause of death, I mean, most errors in the hospital are not recorded or reported.
Right.
So I would, and that's just hospitals. That's not urgent cares. That's not skilled nursing facilities. That's not in doctors' offices. So it very well could be medical intervention is the #1 cause of death in the country.
Yep. So, some of that information should go on your websites because that's one of the compelling reasons for people to use your service. It's managing their risk. So anyway, so there you go. Anything else? Any other questions, concerns? Ready to move on? Okay, good. So, simple steps for starting your business. Here we go. All right, so I'm going to stop sharing this and I'm going to get onto my other one here. So let's see. Here we go. So I started with the marketing one. So now I have to, I don't know how to move this one forward. Well, yes, I do. Yes, I do. Amazing. Okay, so this one.
Score, you guys, I would like to repeat the offer that Armando did last time. SCORE is an incredible resource and they do not charge. And if you wish to continue to work with Armando, then you certainly can. He works with people all over the United States, which I think is an incredible offer. Thank you.
So this is going to be a little bit of a presentation that talks about your business startup. So if there are any questions as we go through this, I can stop it and we can have the discussion. Okay, here we go.
Oh God, this is good. The second one, you don't have to work so hard. You have to work twice as hard.
Well, wait, okay, so we're gonna go through each of them, right?
All right.
All I need is a good idea to be a successful entrepreneur. Is that a myth or reality?
You guys, is that a myth or a reality?
Myth.
Yes, it's a myth. That's correct. And if you go out on your own, you won't have to work so hard or such long hours.
Myth.
Karen already blew that one because she's laughing. So myth or reality, you'll be able to deduct everything so you don't have to pay taxes.
Myth.
There you go, right? It's a myth. If you work independently, you won't have to report to a boss.
Myth.
Yes, there's other stakeholders who are just as bad. Business owners get to do the work they want to do and only when they find it interesting,
Big fat lie.
right? If you choose to be self-employed, you'll be limited to what you can achieve since you'll be working alone. So let's look at the reality. You can read these. Oops, wait. So let me go and select submit. Okay, so we're going to submit this.
Armando, there's no sound on our end.
So you said there's no sound?
Yeah,
Correct.
Oh. Oh, okay.
but we can read it. You might want to point out, the reality.
Okay, sure. I could do that. Says you probably work harder and longer than you ever worked before, but you'll enjoy it more.
We've got feedback.
I don't know where that's coming from. So,
What?
Maybe it's his video that's trying.
it's possible. It's very possible. So let me just say that this is, let's, if we could move on to the next one, maybe the sound will improve.
But this is information that you will send out, right? So
Yes,
we
that
can
is correct.
include it
Yes.
again and again.
Deb, can you mute?
Let me see if I can mute then. So yeah, that'll be a good idea. Hold on. So,
I'll mute, believe it or not.
Still no sound.
Is there supposed to be sound, Armando? Because there's not.
there was
I
no
can hear
sound in
you.
any of that?
No, but I can hear
Oh.
you now. I can hear you now.
Oh, because there was supposed to be sound. And that's interesting. And I apologize for that because why I thought we had sound at the beginning, did we not?
No,
No sound at all.
none.
but I can hear you now.
Yeah, well, the presentation actually has sound. So,
Well, will you
okay.
be the sound?
I can be some of the sound. Yes, I can. So let me go back so that it makes a little bit more sense. So let me just go back. Well, okay, so this basically talks about the failure rate of small businesses. Okay, so what they say, and I'll just, as the numbers come up, I'll explain them. Within the first 2 years of ownership, these are the failure rates. 24% of new businesses fail within the first 2 years of ownership. So that means there's a fairly high percentage of 76% succeed after 2 years. Okay, and then it goes to the next. So within the first 3 years of ownership, 62% succeed and only 38% fail. So it says that roughly half of all businesses fail after 5 years. This is
But
no
RNPA
surprise.
has been going, just when I was only doing clients for 7 years, creating the model, I went
Yeah.
on for 7 years, making a good living
Yep.
and learning how to do this.
Yep.
And, we kept going another 13 years. It's 20 years now.
Right. And so the points are like 2 years. If you survive 2 years, you have a better chance of surviving 5. Once you survive 5, and then it starts to move into dollar amounts. So you go from, up to 100,000 in your first 2 years, 1 million in 5 years, and then it just keeps going because one, you've improved your processes. You understand who your business clients are. You have better relationships. People know you. You are a factor in the marketplace. And all of that sort of builds momentum so that your business can actually grow. So in your first 2 years, you're a newbie. You're kind of out there by yourself. And there's a lot of work attached to getting yourself known and selling your services. But once you have momentum, your chances of success substantially increase. So what they say, and this is no surprise, is that proper planning is key. And they give some bullet points about what that really means. So lack of planning is one of the reasons that small businesses fail. So you don't have a business plan, you don't have a marketing plan, you don't have anything written down, you're flying by the seat of your pants. That is not the way to start a business. That's not a way to run a business. It happens, but that's not the best way to do that. So insufficient capitalization is also one of the main reasons why small businesses fail, because really what you have to do is you have to have your own survival at stake. So if you have, let's say, a year's worth of salary that you can go for a year without making any money in your business, that's the kind of capital sufficiency that people are looking for to make your business successful, in addition to making the investment that you need to make, in the business. Not knowing how to manage your cash flow. It's one thing to read your numbers, to have a balance sheet, to have a cash flow statement, or to have a profit and loss statement. But really, if you don't have any cash, it's like you don't have any blood. You will not survive. And so you need to understand how to manage your cash flow. And some of the ways that you do that is you ask for credit and you pay in 30 days or 60 days, and you get your banker to give you a line of credit, but you always have to have cash at your disposal, because if you can't pay your bills, your business is going to close. Improper pricing. So I did read some of the marketing and business plans that were submitted. And what I would say, and this is not a criticism, it's just an observation, is that you all lack confidence about what you can make. Because really your service is so valuable, you know, and I think that you can make a lot more than the small numbers that you put in your plan. Just saying. So,
Well, what would you pay?
well, if you're asking me for $1,500 up front, I'd say in a minute, okay? Because, you know I have a chronic illness. Even though I read a lot of stuff about diabetes, even though, I see a lot of experts online and stuff, that doesn't help me with my providers, because I have several providers. I have an endocrinologist, I have a primary care physician, I have an ophthalmologist, I have all of these people, and they all ask, I said, well, can I get a letter from this other person? And they never communicate, never, ever, ever, right? And so, and I know what medications I'm taking, I can recite them, but I don't know what they're doing to my body, right? I don't. And my endocrinologist doesn't talk to my primary care provider. And so everybody does prescriptions, and I could be a drug pusher if I wanted to, because I could get all the drugs that I want because they just give them to me. That's not the way to do it. So how much am I willing to pay? I'll tell you
Yeah,
what.
how much per hour? Okay, so you've got the deposit for $1,500 and that's
Yeah.
good. What would
Yeah.
you pay per hour?
Well, for me, I pay between $50 and $100 an hour. You're shaking your head.
Non-nurse patient advocates with no medical background are charging $150 an hour.
There you go. So,
We have two RNPAs, one in Montana, one down in Miami Beach, who are charging $250 and they're getting it.
and that's on an hourly basis, right? But really what you want to do is you want to bundle your services and have like a project fee, like $1,000 a month retainer that'll give people X number of hours, because it's not just a 1 hour session.
Yeah, and
That's very appropriate to say, because this is what we've all been battling with, is how to market this. That's basically what we're talking about here, how to market this service. Do we do it as a one retainer, or do you do it as a beginning retainer, whereas you use your hours to investigate, and that's what you're charging for too, is partially your ability to investigate this whole thing and better than anyone else, and to come up with a conclusion that it makes sense. Does that make sense?
Absolutely. So I look at you like attorneys. So an attorney's case is ongoing. They help people navigate through the legal system, just like you're helping people navigate through the healthcare system. You have a case, so you have to do your research. All of that data collection, you need that in order to formulate a plan or some recommendations at the very least. And then once they accept the recommendations and you formulate a plan, then it's the implementation of the plan. So, and then it's the outcomes. And this is not a 1 hour consult, right? This is, so I would say, just like an attorney, you get a retainer up front, and you get a retainer on a per month basis, which entitles the customer then to a certain number of hours, however many you determine. So let's say you get $1,500 up front, and I know this sounds expensive, but it's like $1,000 a month. But if you have a chronic illness and you are misdiagnosed, you're going to spend a whole bunch more money that way, and two, or it could be fatal, which is, the information that you bring is absolutely priceless. So, it's selling the service really more as an entire case or a project with a beginning, middle, and an end. And they can retain you if they're not going to use your services so much. You can still have like a $500 a month retainer, because really what they're looking for is your expertise, and they want access to you and they want access to your information. Does that make any sense?
Oh, yes. Thank you so much. I really, it
Um,
makes so much sense.
We suggest strongly that you bill every 2 weeks,
Mhm.
because once they get better, they'll forget. Telling you, ask me how I know. So billing every 2 weeks, and it's very simple. There are a number of ways to do that. That we will show you. But you know, it's worth a great deal of money.
It is. And I think that you can make a comparison between, you know, your cost and what it would cost the customer if they did it on their own.
Well, they
You
don't
know.
know how to do it. They can't do it on their own.
Well, exactly, precisely. Just think how many doctors they would have to go to find a solution. Okay, and each one of those visits costs a lot of money. You know, and they don't know insurance coding, they don't know any of that. So you really are, even though you charge more or you charge for your service, it's still a much more valuable service than if they did it on their own. It's less expensive than if they did it on their own, or if someone else who is not as credentialed or as knowledgeable as you guys try to do it and help them. Just because, oh yeah, you know, I can interface with the doctors, that means nothing. They don't have what you have.
Tell us again how important our registered nursing license is.
Oh my God, it's huge. Okay, you have credentials. That's what differentiates you from the other patient advocates. Okay, because one, you have a healthcare credential that is recognized by the medical industry, right? So you can walk in the door and be credible, right? And the other thing is you have a certification that says that you are a certified patient advocate. That means you got an education, you know, you learned about patient advocacy, you understand the science, you understand the system, you understand how to interact and coordinate with different providers, you understand what providers to go to, you understand medication, you know how to secure medical data nobody else knows how to do. I mean, there's lots of things that you
Yeah,
have.
and we analyzed the data with 5 screens: traditional Western medicine, systems biology, human microbiome, functional medicine, and integrated medicine. So we look at the information with a number of different scientific screens, which means when we come out with your chronology, it is unlike any, that's why NIH has it.
Yes.
There's nothing else like it, because it tells you A, root cause, and B, it gives every physician working with you an accurate way of knowing exactly what's going on.
Right, right. That the patient could never do for themselves.
Wow. That's that makes you have a lot more confidence then in wanting to charge more, because I think you really hit the nail on the head that, you know, for so long we worked in places that were so short-staffed and this and that, and so it was always up to us to fill in the gap. And so we still feel that same way. We have that same mentality.
So here's your opportunity to change it. Because the people that you're going to be dealing with now know far less than you do. And I mean, you are, without a doubt, the subject matter experts on all of it.
Wow. Okay, that builds confidence.
Good, you should be, you know, and confident in what you bring, because you bring a lot, confident that it has value to people, a lot of value. And that, you know, this $1,500 is like nothing, right? And it's like, it's an ongoing basis, because you are saving people's lives and you're saving people money and you're saving people a lot of mistakes. You're managing their risks is what you're doing. So you guys are at the front end of something amazing.
Yeah.
I think you put it into different terminology than we looked at. you know, and I think that really helps because by creating like more of a canopy of like business, and then including ours in that, I think it shows us some things that I think we didn't think about.
Like what?
Like about capitalize, you know, how much you manage, manage your cash flow and improper pricing. I think those are like, just looking at the screen right here, that tells me why I haven't done as good as I should be. Because I'm afraid to charge what I should.
Oh, Lord of mercy.
So now you can go out and say, you know, whatever you're charging, triple the price.
Yeah. So I think that makes a big difference, you know, because if you don't have the cash flow to stand behind this business for a little while to get it going, I think that's another thing about cash flow that makes a difference.
Mhm. Well, you have to pay yourself first. So you have to earn a living. At the very least, it's you and then the business, right? So, you know, you're in this, and I know it's probably, you're thinking, well, I'm doing this to serve humanity, but you know, you're not. A business is for the purpose of making money, period, end of story. You have a great service. It's a great idea. You have all of the credentials. You have a structure, which is really, I didn't know that, but you have a structure to lean on here. And so you can really move this. And right now is the time to strike because you don't really have much in the way of legitimate competition. You can be out there and you can own the market.
That's awesome.
Yes, you are.
We are number 1 in the country.
No surprise. Because you've organized
You're
it,
right,
you've
because
planned
you
it.
look, you when you think about our competition, we really have no competition.
There you
Not
go.
at the level we practice. no.
Correct. Correct.
All right,
I mean,
some of you
other
classmates.
patient advocates don't even have a process. You have to have a reality process that's based on experience. You can't just make it up, you know, which is what a lot of them are doing.
Yeah. So I'll tell you a story. I had a client come to me through SCORE and said, well, I want to become a patient advocate. And I said, okay, so what's your experience? She said, well, you know, I've helped, you know, 3 or 4 family members. I've gone to their doctor visits. I've talked to the doctor. I've helped them, you know, through this. And I think I can do this. I said, okay. I said, well, are there any courses that you can take? And I think they ran into your organization. She said, yeah, but you know, you have to have a registered nurse certification. It's like, okay. So you've eliminated one of your competitors right away. So, you know, I counseled her about what the business might look like and, you know, why, you know, she might consider it. And so, but I haven't heard from her since. But, you know, and then you called, Karen, and it's like, oh my God, here it is. And this is so different because you have all of the structure, you have support, you have, you know, you have a contract, you have a way of charging. So the only thing that's really missing now is your business structures and the confidence, you know, to go out and sell this thing. And I'll tell you what, if you go out and, you know, you plant all those seeds, you're going to get more business than you know what to do with. Because this is the time. People like me are aging. So there's more and greater use of the healthcare system. And people, children, have no idea what to do with their parents. So they're the ones that are looking for help. And then you have people who have chronic illnesses or who have post-COVID disabilities, right? And so they need people like you. You're going to be in so much demand that you're going to be able to pick your space and be specific about that, because what you don't want to do is you don't want to overwhelm yourself. You want to have a nice, you know, quality of life balance, and you want to make good money, but you want to have customers or clients that value you and trust you and that you like to work with as well.
one thing I would like to add is that what you just said, Armando, about picking your clientele. Most RNPAs start out with just a generalist practice, whatever walks in the door. Thank you very much. But then the more they do it, they start to specialize. And what you said about, the grown children don't know what to do. There's actually an RNPA down in San Diego who has created an entire national business doing exactly that. And she's very successful. I mean, so you are absolutely correct. You are going to craft your practice.
Okay. Other questions before we move on? I'm not happy that my presentation doesn't have any sound.
Yeah, but we have you.
Okay. Adequate capital, right? So we know what that is. I know all of you can do that because you've worked in a healthcare setting, so you do all of that already, the ability to manage and multitask. That goes without saying. You already have your education as nurses. Now you're getting this credential and this new learning as patient advocates. So, and that really is a competitive advantage for you. I assume that you're all, you like to work because that's important. It just is, that's all.
We're nurses, yeah.
Yeah, so you work 24/7. We get it. And then it's in this case for you, it really is managing your time, because for you, time really is money. Because that's the resource that you have to sell is your time. And so you should make it expensive for people to have. And one of the other things I would advise, and I know it's hard for some people, is you have to say no. And you have to say no more often than you say yes.
Yeah, that's what the screening's for.
Okay. The willingness to ask for input from others. Entrepreneurs, especially people who have their own companies, even though they have employees, are always feeling like they're alone and they have no one to talk to. And that's a very bad thing because, your brain capacity and your energy capacity is limited. And so it really is important to have a circle of people that you trust and that support you and that want to support you and that want to see you succeed. And, have them be your informal advisors, have someone to talk to, someone who understands you, understands your business, can give you positive or negative feedback, and at least give you, at the very least, a listening ear and a place to go. Because at some point, you're going to find yourself boxed into a corner. You're going to be awfully stressed and you're not going to know what to do. And it's always helpful to have someone to go to. That's what mentors are for.
Wow, you hit the nail on the head because I think that's almost how the way we run the business with Karen, and she really uses us as a lot of feedback for things and has this good support system. So when she goes forward with decisions, she feels more confident. And so that's looking at our business at even a different level and looking at a way Karen has to look at things. And so that even takes it to a different level than the rest of the way that the students have to look at their business.
Yeah. But you're going to be a CEO here pretty soon. So you're going to run into what Karen has already run into. So, but
Yeah, and learn from my mistakes, please.
Well, that's why we're here. That's why we're here. Okay. Let's see. Okay, so I don't want to go through all this. You're not buying a business, you're not buying a franchise. I don't know if we could rightly call you a home-based business. I would say that you're more of a virtual business because the places that you're going to be are in healthcare settings. You're going to be with clients where they are. You're not going to have necessarily an office. So, I mean, if you really want to, I suppose you could rent, some conference room space if that's what's needed. But you're not really, I wouldn't think of yourself as a home-based business, even though that's where you think you are. You are a virtual business. You are where the client is. You are where the work is, which is in a healthcare environment. Okay, so this is not correct, is what I would say.
Well,
But you're,
the only
go ahead.
thing I would add there is you don't, just picking up on what you said, you don't need an office because after Delta, after COVID, you're going to be in the client's homes, watching, smelling, listening, learning. And this is not, we're not selling shoes. This is not traffic. You're not going to have online, or excuse me, traffic like a shoe store. Anyway, so our office is in our home, which is a tax break. But that's as far as it goes. We go way beyond home-based business. We are out there in the community, big time.
Right. Yeah. And you're also, I don't ignore this, as an online business, because your information has to be out there and it has to be refreshed all the time, because you are aware of the trends, what they are, you know what the data is. And so, you're the ones that are keeping your, stakeholders informed. So when they run into a piece of information that you've put out there, they're apt to call you and say, well, what about this? Right. And then again, you have a client or you have an engagement, and it just continues. So you're a combination of virtual business and online business. I dread going to this. Okay, so we're going to go to the next slide here. So
Yes, excellent.
yes, so I'm sure you like all this. So this is all of you right here. And you don't have one of these.
Yeah.
They used to be called secretaries. Ah, yes, yeah. I mean, and you can get these actually virtual. So, but this is you right here. And these are all of the roles that you are going to play as well, because these are all of the elements or the functions of a business. And all of these things are the things that also enable the business. Technology, I mean, you have to have an email system, you have to have a server, you have to have a subscription to whatever database you're going to be searching, right? So all of these things, so you have to have a fairly robust technology set up even in your home. And those electronic things are facilities. That's what are considered facilities. So even if you are in your home, it's useful to have really good equipment and really reliable and high quality internet, right? Accounting, it's helpful as you go forward and you charge enough money to be able to be profitable, is to have at the very least a bookkeeper or learn how to use QuickBooks. Most accountants take QuickBooks, but if you learn how to use QuickBooks and you understand the accounting system, what comes in, what goes out, how much you have left at the end of the month, that's really helpful. You do your bank reconciliations just to make sure you have money in the bank. So all of those, this is a function of your business that needs tending to. So either you do it or you have somebody else do it. The human resources piece, that's you, because you are the human resource, at least for now. But if you hire people, whether you hire a bookkeeper, whether you hire an IT person, a website manager, all of those people are suppliers, but they're also human resources. And you're going to hire contractors once in a while, a 1099, not a W-2. And so you need to understand the difference between hiring a contractor and hiring an employee, because there's very definite differences around that.
Yeah,
Yes, ma'am.
hiring employees is very expensive.
It is.
Ask me how I know. I did it way early. I hired 2 RNs to help me grow this thing and paid them lots and lots of money, and it was a waste. And so we work with contract people now.
Right.
So we don't have to pay all of those expenses.
Correct. So, you have to pay 7.5% of that person's wages, to the government, for their Social Security, their Medicare, and the payroll taxes. And you have to pay those every 2 weeks. So just so you know. Marketing, we think we've talked enough about that. So, but that's a function. Sales, that's you. The CEO is responsible for sales. You're the one that has to close the deal because the people are buying you and they're buying your service. They're buying your expertise. Customer service. Customer service is important because that's the communication. You have to give people updates. You have to tell them where they are. You have to tell them, what they need to do next. And even after your engagement with them terminates, it's always a good idea to just reach out once in a while and say, how are you doing? What's going on? Because you never know, the service after the sale is important. And then you never know when their condition is going to change and they're going to want to come back to you. Okay. So, and you also have all of their records that nobody else is going to have. And so they're going to want to come back to you. And just as a way of making money, I charge an archival fee. Oh, you want to retrieve your stuff? Okay, $50. Here you go. Just a thought. And then production and fulfillment. Fulfillment is actually delivering the product that you're going to deliver, because sometimes it's documentation, sometimes it's actually being there and delivering the service, in the room with the healthcare provider, or actually coordinating all of the healthcare providers and the treatment. So, understand, that you are responsible for every single one of these things, and that is your function. So, but don't be intimidated by it, because it, some days it happens all at once and some days you're cool. And, Karen can tell you how it works. Any questions about this?
You kind of reminded me of what I thought about my heating and cooling system people. What they deliver and when they come and how nice they are and whether they do what they say they're going to do and what they get there on time. It really makes a difference.
Yes, it does. And if they care about you, they put you on a maintenance schedule, right?
Yeah, exactly. Yeah. I'm totally on a maintenance schedule with them.
Right. And so your patient should be on a maintenance schedule with you too, because their condition is probably, it's going to improve while they have you, and it may get better, it may not. Depends, and if you're elderly, chances are it's going to deteriorate over time. So you want them on a maintenance schedule so you can do some preventive stuff too. So, okay, questions? There we go. Okay, so whoops.
If I may
Yes.
ask the class a question. We've been going over some extremely important information as regards starting your business. And I don't hear any of you asking questions other than Nan and I. So I'd like to hear from you. Are you following? Is it making sense? What are your questions? I mean, you're silent. Silent is not good. So
I'm taking it all in. I'm following, but I'm taking it all in too. I'm a little overwhelmed. Overwhelmed.
Yeah.
what is overwhelming?
Just all the different roles that were to play in starting the steps to start the business. Where do you start first? I know that Armando is very good about explaining, everything step by step, but then, what I tend to do is I look at all the steps and I went, oh my gosh, there's marketing, there's accounting, there's HR, there's sales, there's customer service, there's fulfillment. just like, where do I start first?
Okay. I think that's an excellent point, so how do you prioritize? Right? Because I think that's a really good way to look at it. Okay, so last week we went through the business structure. I mean, some really basic stuff about getting your LLC, getting your EIN, getting your bank account, right? Getting your name. So we're going to assume that you have all of that, right? So the next thing really, and we started with marketing, and Karen started you with marketing because getting a customer is the most important thing, right? And so right now it's really how you position yourself, how you go out to get a client. I mean, you're going to make some mistakes, but at the very least, just go out and try it. Go out once you get your certification and say, ask some of your friends, do you know someone who could use my help? And then, or in your practice, in your setting, do you know of people that you may have had as patients before that could use your help, that you can reach out to and say, look, I'm doing this now. I noticed that when you were doing this, I couldn't help you as much as I can now. Here's what I'm offering to do for you, and have a conversation. And for you guys, because you are cutting edge, it's going to be an education process, a consultative process to your customers. And that's really where you start. And, then once you start to get your customers, then it's the contractual piece. It's the billing piece. That's when you start to get into the accounting, but the marketing piece is kind of first on your list. And then, then the sales piece comes into play. So as you go along through your journey, don't think you have to do everything all at once. You're going to run into what you're going to run into, and you're not without resources. You can ask questions of, the people that you choose to ask questions of, and SCORE is here to help you. So don't be intimidated. I mean, you're going through, this journey. And as I say to people, it's over time, not overnight.
Well said. Would someone in the class please explain to Armando how we interact with potential clients? Like somebody says, you're an RN patient advocate. What's that? What do you do? What do you do?
What do you say?
Now, come on.
Well,
You start with what Karen always says, and you ask them a question. And you
There's an
say,
echo.
have you ever had a bad experience with your healthcare? And if so, you let them talk about it. And then you can begin asking them questions about how they felt about that experience, and what would they love to see differently. And then you can talk to them about having an RN patient advocate could make that experience a whole lot better and easier for them.
Perfect.
Exactly. It's all
That's
about
it.
them. It's not about us. It's about them.
Right.
And it
Right.
works.
that's very good.
Sure. Absolutely, it does. Because they're engaged right away. Because when people talk about themselves, that's when they're most interested. They don't really care what you have to say, really.
It's true.
So that's a terrific opening. That is an absolute terrific opening. But the real question as a business is, how do you get in front of a person like that? Because that's your prospect right there. That's your prospective client. How do you find people like that to have that conversation with and engage with them?
Well, everyone, they don't have it yet. And I'll, give them a little, you're going to get this. Everybody gets a name badge that says RN patient advocates and whatever else they want on there. And you wear that all the time. I have had RN patient advocates get patients in the grocery line.
Mhm.
Because somebody goes, what? What is that? Thank you. And then you get to interact. And then of course, doing presentations. That's the best way.
Yeah. Yeah. So all of the stuff that I have lots of tools and lots of things, you know, and it shouldn't be that complicated. I know we have a lot of things and it does look intimidating, but you know, really it shouldn't be for you. You have so many wonderful assets and you have a lot of really good training already, you know, so it's just, you know, actually just getting out there and going through the experience and, you know, just going through your journey. And at some point, you know, you're going to really love it because you're going to make a huge difference. So the only thing I would say is that, you know, you have to get a little bit more oriented in running a business as opposed to caring for someone. Even though caring is a part of it, you have to be a little bit cold-blooded about your time and about making money, because that's your livelihood now.
And you have many resources, starting with RNPA, certainly with Armando, with
Yeah.
SCORE. I mean, you have resources. We're going to hold your hand and go, here's what we're going to do. And to walk you through this, you're not alone.
You're not. You're not.
So what are the other concerns? Okay, feeling overwhelmed. And Paige, thank you for that. Anybody else?
So
You're
we're not gonna be doing clinical stuff, right? Karen, you said we're just doing the histories and helping patients. How do you explain to a patient that we're not hands-on without making them feel like we don't care?
That's a really good
That's a
question.
good
Would somebody
question.
else besides me like to answer that?
Well, you know, one way, just a suggestion, is that you have to be clear about your role. You know, yes, you are a credentialed RN, but you're not the caregiver anymore. You're the healthcare facilitator now. And so you need to help the client differentiate between what it is that you used to do as a healthcare provider versus a healthcare advocate, because your role really has changed. You no longer give care, you enable care. And you
Oh,
allow-
nicely said. Oh, write
Very
that one
good.
down.
That's very good. Thank you.
And it's right in the contract.
Because we're going to facilitate that.
Wait, we're getting the feedback. Who's asking
Yeah.
what?
I'm getting. I was trying to say something, but I don't want to do that. I was just saying we're going to facilitate the care.
Didn't understand that.
You're muted, Karen.
You'll please need to repeat that, Deb, because it came across like.
Yeah. I think her internet is unstable.
Can you
Yeah.
hear me now?
Not really.
Mhm.
Can you write your question in the chat box?
Ah,
So Karen, while she's doing that, so I have been attempting for the last, since June, to put together a web page. And the hardest part that I have run across is how do you label this? How do you explain it? And then what search terms would people use to look for me? And those are the questions that I'm just beating my head against the wall with. Because if you talk about advocacy, some people have an understanding of what that is, but others don't. If you talk about home health care and elder care and end of life, I want to help coordinate those services, but I'm not going to provide the home health. So I'm really struggling with how to articulate on the website in a meaningful way that's not, 5,000 words, what it is I offer.
Well, I would suggest that you start looking at RNPA websites, because
I
there's
have.
there's quite a variety, and that'll give you a lot of ideas.
Yeah, and you can find some search terms for them there. And I don't have the mechanics of it, but there is a way that you can look. It'll give you the top 100 search words, the keywords for either patient advocacy or healthcare. And within those 100, you'll be able to find maybe the 5 or 6 that will cause someone to search for what it is that you do. And maybe you can align your term or your keywords so that when people search for that, they actually reach you. I mean, I understand, advocacy is like, I used to be a community organizer back in the day. And so that was considered advocacy. Being a lawyer is being an advocate for your client. So there haven't been very many healthcare or patient advocates in the past. I mean, people assumed that the doctor was your advocate or the nurse was your advocate or somebody else. And so this is a whole completely new thing. And so what is the terminology, as you say, that is gonna resonate with people so that they understand what it is that you're really doing now? And it's still new.
During the residential, Armando, every small group of, at least 3 people have been given what we call a patient avatar. This is all the background information on chronic, serious, complex. And during the residential, we start with the screening, we go through assessment, we go through the educational assessment. So at the residential, everyone works an entire case from the very beginning. So a lot of these questions will be answered because we will be doing sampling. The educators will be doing a sample, one of this, and then you do it. I mean, you're going to get practice. So there's still a lot to come.
Okay. Well, I don't want to get ahead of you. So what other questions, concerns, fears, constraints do you feel? And it's okay to feel them, by the way.
What would be most helpful to you at this juncture, knowing that you still have a bunch to come? Armando, I cannot thank you enough for allowing us to avail ourselves of your guidance. Truly, thank you.
A lot of you were able, Armando, you were able to look at a lot of people's marketing plans, and maybe you could give us a little feedback.
Sure, I can do that. So, as I mentioned at the outset, you all collected a lot of data. So what I would say is that you know your healthcare market well. But as I mentioned at the top, the pieces that are missing are really, how do you attract clients to your practice, right? And so, but that was for the marketing piece. Some of you actually had some very good ideas about what you wanted to do. You actually had many steps that you put in some sort of order. So you have a lot of thought that went into those things. You are on the right path, is what I would say. And so you've done your first due diligence. And so the thing I'd like to show you, because I think it's probably worthwhile at this point for me to show you this piece. Let's see. Here it is.
Do you have a business plan template?
Well, okay, yes,
Speak of the devil.
yes. Well, and I want to refer you to the SCORE website. It's score.org. But basically, and we touched on this last week. It's a business plan is a roadmap for your journey. It defines the purpose of your business. It puts boundaries around how you want the business to fit into your life, because you don't want it to overwhelm you. And it's a tool for budgeting and allocating your scarce resources. And again, you'll have this. It's just as simple as that. I mean, people want to complicate it, with a lot of financials and a lot of other information. It's really, this business plan is for you. Okay. It helps you move forward. And so for me, it's like what you started to do was in your plans that you submitted to me is, what is the business opportunity? You're helping to identify what that really is. And from what I read, it's huge, right? And then how do you take advantage of the trends? And the trends are older people, greater use of the healthcare system, people with COVID, all of these things they're all moving in your direction. You are standing on the railroad tracks and the train is coming at you. And, we've talked a lot about how you attract clients, because the business opportunity is because people are using the healthcare system so much and they don't understand it. And it's hugely confusing. And they don't understand their own illnesses. They don't understand their whole treatment. They say yes to the doctors because what else are they going to say? Right? So the question is, how do you take your persona, your knowledge, all of these valuable attributes that you have, and you go out there to the place where it's fertile ground? And all of those places that I mentioned earlier, the healthcare associations, the healthcare systems, all of those places, that's where sick people are, that's where lost people are. You show up there and you say, oh, this is what I do. You're going to be the one person that sees in a country of blind people, right? You're going to be, so special there. And then the other question that was asked last week is, how much startup capital do you need? Well, how much do you need to live on for a year without any income? And then, it's whatever expenses you think you're going to spend on setting up your business office and setting up your
I
business.
think you should let her know that.
What?
Okay.
What, Nan?
Did someone?
Oh, I just talked and I didn't mean to.
Okay. And one of the things that people don't do, but I think they should, is do an inventory of their resources, because people think that they're out there and they play the victim and they feel that they're just out there by themselves with nothing. And you have so many resources. I mean, Karen has provided you with so much. You have no idea how much knowledge and information you have to be able to do something amazing in a very short amount of time. And as you pull together your resources, figure out who the people are that you trust and who can help you and who wants to help you. It's not the naysayers, it's the people who aren't. You don't want the people who say, no, you can't do that. You want the people who say, wow, that's really good. How can I help you? And they really can. They can either refer a client, they can give you money, they can do whatever it is that you need done. Those are the people that you want surrounding you. That's what your business plan really should look like. And it's for you, so that you have the confidence to take this journey. You're planning a trip, and you're planning a trip for the next 10 years. So figure it out. You guys are smart.
Can I ask a question?
Sure you
Karen
can.
or Nan or is it Shayna or I think Shayna that's there. Do any of you guys do a sliding scale?
No. Nan?
I,
Shayna?
oh, that is so funny, because that's like my whole MO on a sliding scale. would I take this patient, or on a sliding scale, how do I feel about this? So no, I think a sliding scale, because it helps you stick to your goals. It really does. It helps you stick to how do you want to attract your clients? Just what we're talking about here. So that's my take on that.
How do you
Well,
orchestrate that though?
I disagree.
Okay.
If you are charging and getting paid for your amazing service, you are also going to do pro bonos. And because you'll be able to afford it. But if you offer a sliding scale up front, well, they're going to pick, I'll pay you $25 an hour. I'm just saying that creates opportunity for less money for you.
Oh, I agree, Karen. I totally agree. I'm sorry to have the thought in a way that I would just put all my patients on a sliding scale. No, I think it has to be a pick and choose and a pro bono type of thing, as Armando was saying. So I agree with you, Karen. The normal patient who can pay, I don't think you should put on a scale of sliding 1 to 10.
No. And you do pro bono. I mean, when I was doing nothing but cases, probably every year I would do 2 or 3 pro bonos, big ones.
Mhm.
Because I'm a nurse and I could. But obviously you're not going to do a lot of pro bonos, particularly in your first year.
So set your price, and then
Yeah.
when you feel like you've got the energy or the resources, whatever, you've got a few clients that are paying you a decent amount of money, so you're like, okay, I can take somebody else on it at a real reduced rate because the income is coming in.
Yeah, exactly.
Yeah, so I mean, that's your choice, of course, but I would offer this as a perspective. You guys are the highest quality patient advocate you could possibly get. And so if you reduce your price, you lessen the price of everybody else, and that's really not what you want to do, because you're the one that set the standard really for quality and pricing because of your credentials and because of what you have. Everybody else is less organized, less process driven, and less credentialed than you are. So if the less credential is going to charge $25, then you're going to get into a price war, and they're going to say, well, I can go over here for $15 an hour as opposed to you for 25.
Good, go.
So more of my thinking was saying, okay, I'm going to charge, I don't know, between 100 and 150, or between 125 and $175 an hour, and leave it at my minimum is this. But I'm of the mindset that I'm willing to help other patients if there are people who are willing to pay at the higher rate to help cover others that are less fortunate. And there may not be a lot of people that do that, but I think there are some in my area that would definitely kick into that, to say, oh yeah, I'll give you an extra $1,000 if I know you're going to use that to help somebody who really needs it.
Right. And that's a personal choice, and you can make that decision. Absolutely.
Okay.
That when the rubber hits the road and you take your first client, all of these things are going to be swirling around in your head, but you will have process. Follow the process, okay? Use the tools that you are being taught, particularly Medicaid. Oh boy, wait to hear about that, Armando. Anyway, it's all going to come together at the residential. And when you get your first client, you have plenty of support,
And one of the things that wasn't said here, small businesses fail because they lack processes. I'm a corporate guy. I live by processes. But really, what you want to do is you want to have a repeatable business. And the processes make that happen, because you don't want to reinvent the wheel every time you get a new client. If you have the processes, that allows you to optimize your time, optimize your resources, and you can charge, and you can get more clients, and do it much more efficiently with the process than without.
Yeah, the reason, particularly with non-nurse patient advocates, they have a lot of passion. Oh, I helped my mother, I helped my son, they have a lot of passion, but they don't have medical knowledge and they do not have process. You have to have process. That's why I took 7 years. This is real. It's been used on patients all over the country. So I totally agree. Process is where it's at, and you've got it. You've got process.
You do. That is huge for a small business. That's huge. You have no idea. That's gonna help you succeed. That's like 50% of your success right there.
What did you think of our process? I sent him, by the way, guys, I sent him our process so that when he works with you individually, he kind of knows exactly what you're talking about.
Yeah, blew me away.
Yeah,
Had no
you like
idea.
it?
Oh, I did. I was like, whoa. And I showed it to my wife, even though I wasn't supposed to show it to anybody. I said, look at this.
Are processes part of your IP?
I would say so.
Oh, yeah. Oh, yeah.
Okay.
Yeah, don't give them away.
No. Everyone signs a non-disclosure, non-compete. And RNPA owns the process, but everyone in this class is yours to use, not to share, but it's yours to use throughout your entire career.
Right, right.
And PS, if you notice a way that the process can be better, for heaven's sake, speak up. We have made changes to the process through people going, well, what do you think about this, Karen? And it's a great idea. Well, put it in. The process is meant to evolve according to practice.
Right.
Questions? How prepared do you feel to begin to take a look at business planning? Is that still woo-woo, or are you seeing that, you can go to SCORE and you can get the actual template, you can get support from Armando? Is this looking like something you can do? Somebody talk to me.
Yes.
Yes?
Yes.
Amy?
Yeah, if there's a template on SCORE, I guess I'd like to see it.
Sure. Before we got on, I'll send you, it's a combination of the lean canvas, which has all of the components of what a business is, and it includes a workbook. So you can fill it in, and all that is it'll tell you where you are in your thinking today, right? And as you move forward with a mentor, whoever, then you'll start to see where your gaps are, and you'll start to understand how to fill them. So the plan is just is your thinking, and part of the change that you all have to go through is from being an employee or a contractor to being someone who actually drives the business itself and drives your time and drives your income. And that's kind of the business mindset. And I'd even suggest you go hang out with another small business person and just ask them about their business and hear what they have to say. So because it is a change in the way that you think. And right now, I mean, it's sort of like you take an accounting class and you go, I don't even understand what they're talking about. And that's kind of where I think you all are. I mean, you're in a good spot because you have a lot of knowledge that you're getting about patient advocacy and the business model that's there, and you have the process. But actually running the business, that's a little bit of a different animal that I know that you're not familiar with and that we're trying to help you grasp and embrace at some point.
Well, in terms of doing exactly that, Armando, could you speak about networking?
Oh, my favorite
Finding
topic.
people, chambers of commerce, or, you know, professional groups, stuff like that.
Yes, absolutely. Well, you know, chambers of commerce are places to network with other small business people, right? But I would be very thoughtful about which chambers of commerce that you go to, because many are quite localized. And so they may or may not have physicians as members. They may not have a healthcare system as a member. So you want to go to a chamber of commerce that maybe has people with patients in it, right? So that's kind of one. But the other thing is, you know, all people get ill at some point. So you have chambers of commerce with very small businesses that, you know, have a lot of young people. And then you have chambers of commerce, they're two-tiered. They have small startup businesses like yours, and they provide some help in that. Then they have the larger established businesses, and they tend to pay more attention to the larger businesses because they pay more in dues than you do. But so when you make an investment of your time in a business association, whatever it is, right? You need to put in money and you need to put in time, and that's how you get the benefit of it. So there's lots of business associations out there. There's lots of chambers of commerce out there. There's a lot of women's business organizations out there. There's different ethnic groups that have business associations, and they're all in the form of networking. They're all working to try to do something. One organization that you may, well, you're not all local, so sorry, but we have an organization here called Startup Tucson. It's hosted by the University of Arizona, and they help people. They go through like a five-part course similar to what we do. It also is no cost. They also help you find funding. They connect you to, other business people. They have what they call angel investors. So angel investors are people who will float an idea or fund an idea with no expectation of getting money back or the expectation of getting a ton of money back. So it's just how you want to make your entry into the business community, because the business people are all about trying to find other customers. There's another organization called the Business Networking International, and it charges about $70 a month, but they do referrals within their network. It's a group usually of about 15 businesses, and they are very disciplined about trying to do business with each other and finding jobs and opportunities for each other. So that's the kind of group I would recommend for an organization like you, because all of a sudden you're going to have 15 other people that are going to talk about your business and are going to refer people your way.
Also, there's another group, National Association of Women Business Owners, or NAWBO.
NAWBO, yeah.
They want to know. They want to know, what are you doing? You're going to get up in front of the entire group. You're going to talk about it. You're going to learn about their small businesses. They are going to, it's an amazing support group. And I suggest you see if there is one in your community. That was incredibly helpful. Just to give a little background, I joined, not knowing better, I joined the Tucson Chamber of Commerce. I thought, well, that's the way to go. Well, it costs a lot of money, hundreds of dollars a year, which, and then when I wanted to get networking, I found out that their networking is done in a wine bar. Hey, I don't want to hear what you've got to say after you've had 2 glasses of wine, 3 glasses of wine. I'm not a drinker. I'm interested in business. And there are others here, the Marana Chamber of Commerce. There are other chambers that are much more, you may pick a smaller one that's much more open to networking and supporting each other.
Right.
So just really research, because I didn't.
Yeah. Are we good? Do we have any other questions? What else can I do to help you on your journey?
Okay.
Because I'm
Questions,
more
please.
excited than many of you are, because I just see the potential here. It's like, wow.
I
mean-
think I'm in agreement with you. I see the potential and I really see it because I mean, there's been so many people that I've had to help. So how could it not be that if I know 5 people within my own family, there must be 10, 15, 20 right inside the group that we already know on Facebook.
Yep. Yep.
Yeah, I think it'd be helpful maybe to role play with each
Oh,
other.
there's going to be a lot of role playing. in the room.
Okay.
Trust me.
Okay.
Yeah. So I'm hoping one of you is going to be on Facebook or TikTok or something like that and become an influencer. Because if you can become an influencer and educate people about patient advocacy, that's going to open up a whole new world for a lot of people.
We just got a question. Oh, it's a private membership association. That was my question. What is in PMA? I don't understand. I haven't utilized that. Has anybody used a professional membership association? Do you know anything about that, Armando?
I don't, sorry.
No, I don't either. Might be very helpful. I don't know. Okay, Armando. Gracias. Would you put up on the screen, please, how we can get in touch with you?
Of course, absolutely. There we are. I would encourage you to go to score.org. That has it, and there's a little tab that says browse the library. You can see all of the workshops that we offer and all the tools that we have available. You know, obviously I'm in Southern Arizona. I'm in Tucson along with Karen. So the SCORE Southern Arizona is very focused on Southern Arizona, obviously. And my email address is armando.haight@scorevolunteer.org. And that's our SCORE office number. And, you know, Karen has my cell number. So if you need to get a hold of me through that, I could put it up here on the chat. It's easier because I need to keep records too. So that's why I prefer that we go through the SCORE office. But, you know, I am available to you.
I think that's amazing. What an offer. You guys, I'd be taking him up on that one. I think it's wonderful.
Well, let me just say that I want to help you because I really believe in what it is that you're doing. And, you know, I used to run a healthcare organization for Levi Strauss and Company. I was responsible for occupational healthcare and healthcare benefits. And it was one of the most rewarding jobs I ever had because I could put a policy together and it had a huge impact in people's health. So I understand what it is that you do. And I understand the enormity of what it is that you're trying to do. And you're going to change the world here if you haven't already. So I want to support your enterprises because that's the way that, you know, things are going to happen.
God bless you, Armando.
No, God bless you guys. I'm blessed to know you. It's been a privilege for me.
Calling you. I will definitely be calling you.
Okay, I'll expect that.
Thank you.
You're very
Ladies,
welcome.
if you will stay on, please stay on. Okay.
I'll
Thank
see you.
Armando.
Have a good
Hi,
evening.
Armando. Thank you.
Take care.
Thank you.
I will exit
Okay.
here. Let's see. How do I get out? I
Appreciate
leave.
it all.
Take care.
It should
Bye.
be in the lower
Don't
right
forget
hand
to
corner.
send us the link.
Okay. I just got a message that a lot of you are making plans for your trip to Tucson and renting a car. We had not planned to do this today, but I need to caution you. We have met several times as an organization and all of the people who are instructors. 1 in 367 people in Pima County, which is where we are dead. Transmission level is in the highest red zone. In Arizona, it's one in every 400. This
Actually,
is
it's 1 in every 267.
well, that's a new number for me. Is that the number today?
Yeah, that's what I saw.
All right.
267 new cases a day.
Yeah. And there are nationally more than 2,000 deaths a day. Delta is wreaking havoc. So what we have decided, and we have an entire plan, and I'm very sorry that I'm presenting this today, but it needs to be said. We are postponing the residential. It's too dangerous. It's just too dangerous. Don't come here. Really, seriously. There are still a lot of unvaccinated people here. The death rate is high. The death rate is high. Don't come here. All right. That I will tell you, that was a very, very, very hard decision to make, because this being our last live class, I wanted to be with everybody. But it's too dangerous. I can't ask you to take that risk. I don't want to take that risk. So here's the plan. We are going to postpone until the middle of January. However, if we do that, it's going to cost double, because there's a whole lot happening in Tucson at that point in time, and all the hotels are going to be full, and you're going to be paying top dollar. We negotiated down to half price, but that's not going to work in January. So here's what we can do. And the prices don't go down until April. Well, I'm not waiting till April. I'm sure you're not either. So here's what we've decided to do. In between now and the middle of January, every 2 weeks, we are going to give you more content. There's no extra charge. Every 2 weeks. The first program is going to be, what do you want? What do you want more of? What are your questions? What do you need us to give you more? And then every 2 weeks, there will be more. For example, I just talked to somebody today who's going to teach 2 hours of coaching. Remember our coaching session with, didn't work out so well. So we're going to get that. And then in the middle of January, in order to avoid the horrendous cost, even if it's safe to come, who knows? We are going to do Zoom, but we're not going to do it the way we did it last time. Last time we tried to do it in 7 days. So we were on Zoom 8 to 10 hours a day. I thought I was going to die. So did everybody. We're not doing that again. We are going to spread it out over more days and have shorter sessions and much more interaction. So this is not what the plan was. I thought by November we'd be safe, but that was before Delta hit. Now give me feedback. Nan, Shayna, yeah.
Sounds awesome to me.
No, I think it makes sense, I was really disappointed, that, Karen. I wanted everyone to come and I thought we could do it. But then the more, I looked into it and the more I thought about everybody coming here and traveling and staying for a week, I just wasn't sure, and especially if we have some unvaccinated nurses, and they deserve to have their own right to not be vaccinated, and would that making it would that making a difference with the people that were there? So I think there was so many complex parts, and especially about the fact that the hotel can't accommodate us because of the gem show and everything.
Yeah, this is not what we planned. obviously, but I think that we learned a lot about our last Zoom class, which was in 2020. And we're not going to do a lot of that again. We learned our lesson. So give us some feedback.
So Karen, are you saying these Q2 weekly, on Tuesday nights, our classes, we're going to cover some of the content that we would have covered in, no, not at all. So this is going to be extra.
Yeah.
And the Zoom, we will.
This is going to be new stuff that, probably we would have done on the network call.
There's so much stuff that we haven't been able to present to you. It just gets bigger every year and we want to add more and more. And this is giving us an opportunity to give that to you.
This could be a 2-year course. I mean, there is so much to teach. So you're going to get a lot more every 2 weeks. Pardon? Somebody?
There's feedback at you.
There's feedback on
I
me.
think it's Deb.
No, the feedback is Deb. Deb's microphone
on
is
you, Deb.
really good. Deborah's microphone is super awesome.
Yes.
So what do you guys think? I know this is a shock. We didn't make this decision until late last week. We were going to have a Zoom call on Thursday to tell you all, but Shayna let me know that a bunch of you are already looking at car rentals and, plane tickets and everything. And I just found out today that you're already doing that. So I wanted to save you money. So that's why we're doing it after the class. This was not our plan, but you need to know. You
Yeah,
just made the decision.
I've already purchased plane tickets, so I'll have to figure out how to get that, how to refund my money or get a credit or something, which hopefully will be able to happen.
Well, more
Yes,
airlines
exactly.
are allowing that because of Delta. They're allowing you to change your ticket at no cost or to postpone it at no cost. Airlines are really reaching out to help because Delta's everywhere. This is real and it's killing people. And here in Pima, it's bad.
When,
What's the
I had-
vaccination rate of adults there?
What?
What's the vaccination?
What's the vaccination rate of the
Oh,
adults?
for over 65, it's good. But for under that, it's much less. There's a lot of misinformation out there, a lot of misinformation. And, I'm not going to make your decision for you. I know I made mine based upon months of research. So anyway, tell me what you think. Is this okay with you? Because if it's not, I don't know what the heck we're going to do. I don't want it. I don't want you coming here. Your chance of transmission is extraordinarily high. You're going to be going out to restaurants. I mean, you're going to be going on airlines, coming from all over the place. You don't want to be in Tucson right now. I don't want to be in Tucson right now. Yeah, Deb.
Honestly, I'm not worried about it. I've been traveling for the last 2 years, every month flying somewhere. I got COVID like last December, and I'm not worried about traveling. I'm going to live my life and do what I need to do. And I'm not worried about going to Arizona. I'm not worried about going to Texas. I'm not worried about going to Florida. I'm not worried about flying anywhere.
Well, that's good for you, but I know the risk here in Pima County, and I'm not willing to open that risk for us. I'm in my mid 70s. I cannot be taking this risk, Like I said, 1 in every, Nancy, 267 people are dead here in this county. It's bad here. So anyway, as I said, we just made this decision.
You're muted, Dan.
I was going to say 267 cases a day here.
Okay, so, well, in the death rate, it's 1 in every 367 people in this county are dead. And that continues.
So
So,
questions.
yeah.
I'm I'm devastated. I wanted to do this intensive. However, I'm super excited because I'm looking at the areas of investigation intake form, and there's 12 areas on there. And I personally would love it if you would like drill down and divide that up into, I don't know, 3 groups or 4 groups, and just don't ask me questions. I want info from you, but just drill down and feed me everything you can tell me about neurologic and the changes based on all the stuff, and then psychosocial, and then endocrine and structural, because I'm like, feed me, Seymour, feed me. I
Oh, wait
need
till you
more
see
input.
what we got planned for you, pal. This is absolutely, the residential is where the rubber hits the road. You will all be doing a case from screening on out. You will all be using areas of investigation. You will all be creating Medicaid. You are all going to do all of these things with us. So everything that you would get other than the, you know, the company, you're going to get online. And we're not going to do it like we did it last time. We made mistakes, not doing that again. So
Karen, can you tell us, no, because it's going to be mid-January, like how when the days will be and when the times will be, so that obviously well enough in advance we can block that stuff out?
absolutely. In fact, one of the tasks that we are going to do as your curriculum committee is, I've already planned out the whole residential. Okay, it's all planned. But obviously, it's not going to be the same. So as your curriculum committee, we're going to take it all apart, and we're going to build it the way it would be most effective on, you know, online. And we will give you plenty of advance notice. As I say, we just made this decision a few days ago. So we don't have that done yet, but we will. Absolutely. Thank you for asking.
So are you saying that there's not going to be an in-person intensive?
There's not. Mm-mm.
Not at all. So then we still have to wait till January to be completed with this program?
Yeah. So instead of being done by the end of November, and you can't really do much in December, ask me how I know. And so you'll finish up in January. Is this optimal? No. Are we happy about this? No. But it's too dangerous here. It's too dangerous. I mean, it's bad.
Okay, well, we have to go along with it. We have to do this. So we just have to plan it out and delay, you know, getting the certification until mid-January. It's at least how.
Well, you're
I-
going to get a lot more content than you normally would have.
Yeah, so I'll just go with it.
Kathy said, can we get some of the resources now and not wait? We have to redesign the entire residential, Kathy. So until we do that, and we still have October, all the October programming to get through to finish the online portion. So we will be redesigning the residential, and we'll give you everything that we can as fast as we can.
So Karen, what you're saying is, because we were ending in October.
Well, that's the online. You're done. I think it's the 22nd or 23rd.
Right, so then 2 weeks
Great.
later, we'll have a class.
No.
and 2 weeks later, we'll have a class into December.
The first class, what was it? We decided November 4th. I mean, we're going to start when the residential would have started. On the 3rd, on 11/3, 11/16, 11/30, 12/14, 1/4, 1/18.
Well, the January dates, we don't quite know yet.
Yeah, the January depends on, you know, how we're going to restructure. So you get the full benefit, even though you're not here. Not optimal. but people are dying here at a big rate, and I'm not gonna, it doesn't make any sense. When we planned this back in last January and February, we thought we'll be fine by November, because we used to hold it at the end of September or beginning of October. We used to start much earlier, and we thought, no, we got COVID going on. So we'll make it in the middle of November. COVID will be manageable by then. Then Delta happened. So, Christina, what do you think?
Well, I'm a little disappointed, but I do trust your judgment and I do understand that. I've lost family members, so I know how serious it is. So even though it's disappointing, I do feel that safety, should be first and foremost. And I like the idea of getting a little extra during these, extra months, but I was hoping to get started sooner. Is there any way that we could start working on our LLCs? And
Oh my God, you can start now. You can start tomorrow. Yes, you can put your business together. You can put your marketing plan. You can join networking groups. You can do a whole lot. Yeah, absolutely. You don't have to wait until the end of the online residential. No, you can, but please do not take cases. Not yet. You are not ready.
yeah, that's true. But if we can at least get some of the business part to where
Yeah,
as soon as we're done, we're ready to go. I think
you're
that would-
ready to go. Listen,
be-
Armando left the door open. I mean, I think that's incredible. He is obviously a very strong SCORE member. He's in charge of Southern Arizona, and he works with people all over the US. What could be better? Yeah, call him tomorrow. Yes, you can get a whole lot done. And then by the end of the residential, you will be ready. I promise. We've done this 14 times now. So you will be ready. You're not now.
Yeah, I agree. But I would like to.
I can't imagine the people that only did the 4 days, how they were ready when they flew.
The 4 days.
When you
When
first
the first couple classes you did.
Oh
the-
my God. Oh my God. Well, it was that was absolutely insane. But I had to start somewhere. It was just little
Oh, yeah.
Karen doing the little thing. And then the university called and said, come tell us what you're doing. And then began 10 years of intensive mentoring.
Every year it's gotten more and more.
Yeah. Oh my God. Now, listen, I could happily turn this into a 2-year program. You have no idea. I mean, we pack it as much as we can. But there's so much more. There's so much happening. That's something I would like you all to start to do. And that's every single day. Start reading. Finding out what's happening. All right.
Can I make just a plug? The Institute for Integrative Nutrition has their conference the end of October. It's the 28th or the 20th, 29th, and 30th, Thursday, Friday, and Saturday. If you guys haven't looked at that, I'm seriously considering it because it's virtual. It's $295. Perlmutter's talking, and they're doing
Perlmutter, you got Perlmutter?
He's talking.
Oh,
Yeah,
that's worth $290.
he's talking about diet for Alzheimer's prevention.
Yeah, exactly.
And then they're doing women's health and diet, men's health and diet. It looks really good.
Yeah,
Whatever.
that's excellent. Oh God, Perlmutter. The man is a genius person. I've met him. I told him all about what we were doing. He thought it was marvelous. Yeah, that's a real good one. There are so many resources. I mean, I'm obviously not going to tell you all of them right now because it's been a very long day and I'm tired. But we can, I'll show you what I read newspapers, I read science magazines. I look stuff up every single day. You know, you're all life learners or you wouldn't be in this class. So keep it up. Right? You have to be current. Sally, what do you think?
I think it's a good idea, although I'm a little disappointed because I learn best, in person. So I'm glad that you have decided to kind of stretch it out and not do it, in a week's time and have us sit in front of the computer, because I don't know if I could do that.
Oh, God.
But I think that, yeah, I think that, I think it's a good decision given everything that's going on. And I know that it's kind of upsetting to people that we have to wait until the end of January, to be finished with this program.
Middle
Like
of
you said, you
January.
can already start, getting things done. All of
Oh,
the,
you can set up your business.
right, all of the, the work that underneath everything that needs to be done before you actually start.
Yeah, and then by the time we're done with the online residential, you will have everything set up and boom, you go.
Right.
Also, Sally, I wanted to mention that usually the residential isn't recorded. And so doing it this way, you'll have those recordings to look back on. You could
Oh,
take
good
extra
point.
notes and that kind of stuff.
Pretty cool.
Yeah, thank you very much. That's a good point. We have never taped an entire residential because it costs a fortune to have professional videoing of a 7-day program. But you'll have all the tapes. You'll have all the recordings.
How long will the course recordings be available to us for us to look back on?
Forever. They'll be on as long as you're a member of the network and have access to the cafe, they'll be there always. You have always, from the very beginning, been a part of the network. And you will continue to be a part of the network for 3 months after the end of this whole program. You get your certificate, I want everybody to get used to being in the network.
And then
So-
after that, it's 200 a year, 100 for every 6 months.
Yeah. And because I will not be doing online classes anymore, I will still continue to teach. Brad Schwartz at GNA, Greater National Advocates, and I are talking about continuing education on there. I'm still going to be teaching. It's just producing a class like this. It's nearly a year. It's enormous, and I can't do it anymore. So,
Takes a lot out of you.
so I will still be teaching. You'll access it. Join GNA. I'm saying to you, join GNA. Doesn't cost anything. They are really establishing a good teaching program with me. And you can see what everybody else is doing. Because to get in there, you have to say what services you're going to provide. You already know what services you're going to provide. And take a look at what the non-nurse, non-RNPA people are doing. And I'll tell you something else. And this is a little hobby horse of mine. I think it's highly unfortunate that in the field of patient advocacy, since I started it pretty much back in 2002, it's gone kaboom. They're fighting each other. They think that they are in competition. No, there's plenty of work for everybody. I have given talks on this nationally. I don't know why that's the mindset, but joining GNA and participating on there, perhaps Brad will let me do it again, talking about we can help each other. I was at a national conference in San Diego a few years ago, and there were non-nurse patient advocates, and of course there's me. And I said to them, why don't you consult with us for an hour or two? You don't have the medical background. We can give you ideas. We're not taking your case. You can charge it to your client. And no one did. I don't understand, but with more and more of us out there, perhaps we can affect change because we help each other. I mean, you've been helping each other in this entire class.
I think, Karen, a lot of it comes from people operate from the scarcity model as opposed to the abundance model, right? They feel like there's only a finite amount of resources or people or dollars or whatever. And so it's all competition as opposed to there is plenty out there and you just, everybody has their niche and you work with each other.
Yeah, I mean, it's like we are not going to keep up with all the changes in insurance because that would take all your time. So there are insurance advocates and I highly recommend you use them when appropriate. I don't know why we're not helping each other. And one of the things I'm going to talk to Brad about, who started the GNA, is let me get on there again and talk about that. Truly, we should be helping each other, not competing.
Karen, I'm sorry, you may have mentioned this before, but do we have access to the Medikey now, or when are we going to be able to? Because it's nowhere on the cafe.
You are going to be creating a Medikey. We're going to take you step by step at the residential. I mean, you've already learned a lot about it. You know, we started teaching you about it in the very beginning, let you know what it is. We should know by the end of December whether or not we get funded. And boy, that is going to change the entire picture. Oh, baby. So we'll know. But you are going to learn how to do the non-AI type. There are outlines there. You're going to learn it in the residential because nobody has anything like this. Doctors think we walk on water. They look at this and they go, oh my God. ERs have said to us, I can't tell you how many times, everyone needs one of these. Because it's a crapshoot. You go into ERs, you've got a 40% chance of a misdiagnosis. Is it because they're bad? No, it's because they have no information.
Well, it's because I wanted to kind of practice it again, because we did it at the beginning of this course, and then now I don't see it anywhere, you know, and then, so I guess we'll wait till mid-January to do that, to see it again.
Still have access to mine, I think.
Really? I know. I looked on the cafe. I'm looking everywhere and I don't see it. Maybe I'm not looking in the
You
right
have to be taught. You can't just get an outline. You have to be taught. That's why it's not on the cafe. You, during the residential, you will be given all of the guidance. You will have forms to fill out. You will have the areas. Oh God, where do you see the areas? Oh my God.
And I'll be sending you all a package with everything that you need for the residential portion.
Have you got a bag handy? Everybody is going to get, and I am an RNPA, really strong canvas, so like you can use it for something other than groceries.
There'll be other stuff in here.
There'd be a lot of other stuff in there. Everything that you would have gotten at the residential, you're going to get in the mail.
So including like the forms that we'll need to start a business, like HIPAA form, contract.
Well, you do have to purchase the contract because that costs multiple thousands. I had 3 attorneys working on that over the years.
How much you charge for that?
I don't even remember what, $89. I mean, it's just silly. I mean, if you go to an attorney, that's $1,200 before you open your mouth. But we are investing in your success. So, you know, we're not trying to get every single dime from you.
Karen, can I say, I talked with my accountant and his comment, because I talked to him about the LLC as to what to do. And his comment was actually, yeah, you can go do your LLC yourself, but it's full of holes. He's like, you really are not guaranteed. It's no different than being your own, like a sole proprietor. And his recommendation was actually finding a lawyer and help you do it so that you're sure that your LLC is a protection.
Well, that's a very interesting point of view. Every state has different requirements for LLC. I didn't know that here in Arizona, there are forms that it's all lawyer derived and you can fill it out. It costs you about $150 and you've got a rock solid, but every state's not like that, as you point out. So find out. I used an attorney only because I didn't know any better. But not every state is like that. So find out more about LLCs in your state. Maybe your state, it does have holes in it, creating your own LLC. I have no way of knowing. You have to look it up. Look at the Corporation Commission, ask some questions. Because you will be listing on the Corporation Commission.
Okay.
Okay. Any other questions, comments, concerns? I know this is radical. This is not what we wanted to do.
Do you have conferences for just RNPAs, like once a year that you get together with us, or?
Well, we haven't because we've had all these classes, but one of the things that I am talking to several other RNPAs about is having a conference every year. I simply have not had the time to do, I mean, I'm one lady. And
the network, and the network meets not every single month of the year, but many of the months of the year, and we provide educational programs during those meetings. And that it's a way of us networking and staying connected to one another.
Okay.
And an annual conference is absolutely where we're headed. Absolutely, it's got to be for networking, for helping one another, and for continuing education. You know, having some really good speakers. And when Delta and COVID are done with us, whenever that is, we can do it in person. Oh, baby, there are places, wonderful venues where we could all get together, which I'm so looking forward to. I'm not disappearing, guys. I'm just changing how I'm working.
What about the lab trends? When are we supposed to learn about the lab trends, and is there did you say there's like some kind of software for that?
Yeah, absolutely. You're going to get all that. It won't make sense if I just send you the, you know, the outline. It's not going to make sense. You have to apply it using your avatar. You get in there, you work it, then you learn how to use it. But just me telling you, well, you do this and you do this, and makes no sense. You have to use it.
So then we'll be getting that direction.
Oh, absolutely.
For January, or
At January, yeah, at January. See, we have to, as a curriculum committee, we have to get together with everything that I already wrote, and we have to rewrite the whole darn thing to maximize our time with you and, you know, make it as rich as we possibly can. So. Am I happy about this? Are any of us happy about this? No. But it's dangerous here. You don't want to come. Not now. And even if it is safer at the end of January, nobody can afford double. RNPA cannot afford double. You cannot afford double. I mean, we're looking at $200 a day plus.
And nobody wants to wait till April.
And nobody wants to wait until April. Well, that would be foolish. I wouldn't ask that. But you're not going to do much in terms of getting clients around Thanksgiving and Christmas and Hanukkah. So by the middle of January, when you have all this under your belt, you're ready to rock and roll.
I guess we could look at it positively and say if we finished in the middle of November, we'd all be chomping at the want to be doing this through the holidays, and we won't enjoy our holidays. Now we don't have any choice but to celebrate our holidays.
Well, and you can't be out there, trust me, ask me how I know. You can't be out there marketing this stuff on Thanksgiving and Christmas and Hanukkah. It doesn't work. Ask me how I know. What?
People are way too busy around the holidays.
People are way too busy, truly. When all of that is over and your training is over, you know, the middle of January, you're going to be ready to go. You will have already done a lot of the business setup, you know, Armando, and even if you just look at SCORE in your community, you can have your business ready to go. You've got process. We will be taking your avatar through the entire process, starting with screening. We will do you will get a paper that says, here's the screening process. You will watch us do a screening, and then you're going to show us the screening. You're going to get to actually do this with instructors all over the place.
It will all come together.
Yeah, the residential is where the rubber hits the road.
It's the best part.
Yeah. Okay, questions, concerns, anything that we haven't covered? Thank you for bringing that thing up about, Nancy, about the LLC. You have to check with your state. Here in Arizona, it's a slam dunk, but it's not that way in California. It's not that way in New York. They have their own little trails. So find out what it is in your state. Anything else? Okay, well, obviously, we're not going to have a class on Thursday, which is when we had thought to tell you. But then Shayna told me, you guys are already making plans, and I thought we can't let them do that. As I said, we just decided this the end of last week. And I couldn't tell you yesterday because I was teaching nationally with a whole nother program. So this was our opportunity to tell you.
Thank you for being understanding.
Are you disappointed? Not any more than we are. Trust
We all
me.
went through our own disappointments, times,
Yeah,
days.
it's a very, very hard decision to make. Okay, thank you. Thank you.
Good night.
Thank you.